This is an example of an iliopsoas tendon release in a patient who had an entity known as snapping hip, namely internal snapping hip. Here we've made a small window in the anteromedial capsule. We're coming in with a Vulcan probe identifying the tendon itself, which was the large structure that we were palpating there. As we come through that window, typically we'll see a small bursa, which is frequently just adjacent to the tendon itself. You can see the white fibers of the tendinous sheath. Once we've completed the bursectomy, we then swap out to a beaver blade, which we're utilizing here to gently release some of the peritendinous fibers, namely the sheath itself. Our goal is not to actually transect the tendon itself, rather to perform a gentle release such that any type of snapping and or symptomatic painful snapping is resolved. As you can see here, we're starting anteriorly, releasing those white shiny fibers of the sheath itself. Just deep to this are the actual muscular fibers of the muscle belly of the tendon. Again, I like to initiate this with a beaver blade, working through a small window in the capsule itself. Once we've initiated, I then swap back to our Vulcan wand. Here we'll utilize this instrument to complete our release. As can be seen here, releasing some of the fibers. Just deep to that, you see the red muscular fibers of the tendon itself. It's important not to cut through these. Again, as we work through these, frequently you'll see some of the fibers immediately lengthen once the tendon sheath is removed. What's important is also to make sure to get a complete release. You really have to palpate the tendon as you go. The advantage of this instrument is that you can actually work around the tendon almost like a finger. Here you can see there's a few fibers posteriorly we still need to release. And as we work on those fibers, again, you get a sense that there's some lengthening of the tendon itself, once again in hopes of mitigating any type of symptomatic and or painful snap. Thank you.